Welcome back, folks. For this next 35 minutes or so, we're going to spend some time having a discussion about H 545, the act relating to issuing immunization recommendations. And I started to say, I don't know if I just had this in my head and didn't say it out loud, but I think I did say it out loud. But in any event, Zahn is going to be doing the floor report on this. Did I say that yesterday?
Yes.
Okay,
Yeah.
all right, good. Yesterday seems like a blur already, and this is only the second day of the session.
It's
So
the third week
That's your reaction.
it's the third week?
of the session.
Yeah. All right. Don't confuse me.
It feels like.
Calm yourself, nothing else.
Okay, it's relatively short bill. Why don't you pull up the bill on your devices and pull up the 1.1 version. And Katie's already working on an amendment. But let's talk about what we heard yesterday. And Lori, have we heard back from any of the witnesses, the additional witnesses? Like those two folks? No, not yet. Okay. So I want to make sure that people saw in the documents under yesterday, public comments from
Jeremy
Say and Susan Bowen. In particular, those are people who we have not heard from in person. We extended our invitation to them. And Stephanie Winters, who was here yesterday, but her written testimony has now been posted. So when we're looking at the language, one of the things we didn't ask, but I did talk to Katie about, is, the change in the language in vaccines to immunizations, and was there a specific reason? And what Katie said this morning was, it's actually throughout this part of law, it's used interchangeably. And so it's not a big deal. And I said, well, is this making it more consistent or less consistent? And she said more consistent. So that's really all that means. So I thought that was interesting. So on page 1, right at the bottom, was the first sort of comments that we had, both here and then from witnesses, and the use of the term domiciled in the state. So there was a request to remove domiciled. And there was a suggestion, not remember who from, but to use who received care in the state or something like that. What are folks' thoughts about that?
I had just offered that suggestion because the Department of Health initially suggested just going back to the language, which says Vermonters, which I didn't see as really addressing their concern.
It's not any different than this, right?
Cross-border care that's received on New Hampshire, Vermont, New York, Vermont borders. So I had offered receiving care.
Yeah, and I think the problem with that is there are a lot of people who don't receive care routinely, but we want them to be immunized, and that could be misinterpreted as meaning, well, if you're not seeing a doctor included. I don't know.
And I don't know what receiving care, sorry.
Yeah.
Receiving care, whether that requires being under the care of a physician versus going into CVS and getting, so maybe it's to someone seeking immunization.
Yeah. Everybody's
Katie, why don't you join
From New
us?
York who's getting treatment,
Yeah, right.
right? So
We're not really, we're sort of doing pre-markup and having a session.
We're chatting.
We're chatting.
Oh, no.
So the first thing we're chatting about is the language request from the department to go back to Vermonters at the bottom of page 1. And I think Doug pointed out that doesn't really change the language that they're asking to strike, because Vermonter would mean that they're living here. I think the plain language version of that. So we're just trying to come up with language that doesn't exclude anybody who is seeking a vaccine in the state.
Yesterday somebody used individuals who receive care in Vermont.
Yeah, we just decided that wasn't good.
Okay.
Receive
Okay. I suggested it, and then today I tore it apart.
Okay.
So,
So I mean, it was just suggested that individuals seeking vaccinations or immunizations in
Yeah,
Vermont.
ensuring universal access basically to anybody.
For once.
Yeah,
For all
one.
individuals seeking immunizations.
Right.
Oh, yeah.
Can I just ask, as I said about the notion of your first notion, immunization and vaccination?
Oh,
It strikes me that there could be a subtle difference I mean, I get that they're interchangeable. I think they probably are in a lot of ways, but the notion that a public could be concerned about immunizing people, or about the notion of immunization is very different than the notion of vaccination. Vaccination is what you get, the very thing, but immunization is what a public is providing to a people, to a state or a population.
It's almost an outcome of a vaccine.
Right.
Yes, exactly. So it strikes me that the state has an interest in an immunization of its people.
Right.
But individuals get to make the choice about vaccination. And I think that's
right.
And I think that could be useful as we go forward in this conversation, because we're not, as I heard you say yesterday, we're not intending to mandate that everyone be vaccinated, which might answer some of Todd's questions, for instance.
Mhm.
But the notion of immunization is a reasonable thing for a state to have and hold.
And to support and have as a goal, but on the other hand, as you're saying, the universal access is to a vaccine as an
Right.
individual. The
Yes.
goal of the state is immunization
Right, yeah.
by encouraging people to follow a vaccine.
That's how I've been thinking about. I don't know if that would even at all be useful in sort of teasing that out if it's too detailed, but.
I'm not sure that it is. I mean, it's why I asked the question this morning when I was meeting with Katie, and it was a question I had on my list, and I didn't ask it. I just forgot. But I think it warrants a further question back to the department, I guess,
Yeah.
because
It's not up to us to make that decision.
well, it is up to us about
To
whether we
decide.
change, but
But we want to inform.
understand, right, we want to understand better what their thinking was, because I think you make an important point that immunization is the result of having received vaccine. And so it in some cases is interchangeable, in other cases it's not.
Yeah.
I think it's a good point, and not sure, it feels like that we should probably have that on the record, that point on the record. So, I'm just wondering if we could, have Megan back. I wonder if she's able to come back tomorrow or the next day. Maybe Meredith, not Megan, Meredith Plumpton, the immunization program manager, or Jessica. We can reach out to Jessica, the policy director, and Meredith to see.
She's here.
Where? Is she in the room? Oh, I didn't see you, Jessica. I in fact just looked all around the room looking for
Blind spot.
Yeah.
Jessica Shimano, Policy Director, Department of Health, and I have Meredith on my chat, and she's giving me the answer, so.
Okay.
Oh.
All right. That would be great. That'd be great. And are you sufficiently clear about the distinction we're making and the question? Yeah, okay.
Yes, we are.
Okay. So we want to be generic about those people requesting vaccines, and get rid of the domiciled or Vermonter kind of thing. Okay. Okay, so, and more to come on the use of the term immunization. Thank you, Jessica. I felt like, I'm sure they saw it on the agenda. I thought that somebody would be here, and I was like, okay. Okay, and then we move down to line 17. All the other things are about essentially that substitution of that term. The department shall determine which recommended immunization shall be purchased under the program. So I think it's important to notice the difference between the funding program. So there's two things. There's two advisory panels here. There's the funding advisory panel, which we'll talk more about in terms of the removing the requirement to meet. Seems odd.
Yeah.
And then the vaccine advisory panel that is made up of the medical professionals in the field. So just want to make sure that people understand that those two distinctions between the two panels that are referenced in here. So do people have any questions or comments about that line 17 and 18 down there? And also in that little section down there, it says to be able to purchase it from the CDC or another vendor.
What page are we on?
On page 2.
Oh, okay, we're on 2. Thank you.
Yep.
Because I was looking at 17 on page 1.
I did that at first.
Yesterday, a point was raised that the language talks about purchasing from the CDC or another vendor at the lowest available cost identified by the department. So would the department, I think plain language they would be required to get the lowest price. And the point raised yesterday was, what if the CDC's comes with strings attached? Like, we'll sell it to you cheaper, but you must do A, B, and C. And those are not consistent with Vermont's goals. We would then perhaps not be buying from the lowest price vendor.
Yeah, when you brought that up yesterday, I thought that was.
Yeah, I mean, the commissioner responded in a way that didn't actually specifically address that particular issue.
Yeah.
His response, we're looking for very specific drugs that are,
Right.
by name and reference and all of that kind of stuff.
It will not sacrifice quality.
Right, they're not going to
No,
sacrifice.
but
quality.
the strings might be around dosing or things like that.
Or even which vaccines are, you can have, we'll sell you this one at this price if you take this one off the list or something crazy like that.
Or demographics, that would
Yeah,
be.
yeah.
So I think the one thing that we know is that it is a moving target at the federal level.
Yes.
Things are coming out on a daily basis, multiple times a day about lots of different things. And, it's not really up to us to predict what may or may not come out. But I think that we could tweak this language
Yeah.
somewhat, Katie.
It could be unless there is whatever reason to.
I'm not even sure we have to say where we're purchasing them from, I guess.
At all. Oh, yeah.
I'm throwing that out as a question.
Mm.
Do people feel specific about us identifying? So we don't identify what the other vendor might be.
Because we don't know.
Because we don't know.
Right.
But it's the lowest available price
Right.
part of the thing.
What I'm saying is that, do we need to reference any federal source here?
Oh, they're just purchasing vaccines, just.
But do we just need to talk about the purchase?
And not even say anything about cost.
I think that's a question. It's a question of,
For appropriate
have-
appropriate quality at the lowest cost or something like that, maybe.
that meets I like when somebody was going, meets the intent of the state's,
Yeah.
program or whatever they're calling it.
Personally, I like having the reference to trying to get the best price. I think that's
Yeah.
working out for Vermonters and their money. But yeah, with a clause or another lowest available cost identified by the department, that does not require or conflict with the intent of the Vermont immunization schedule or something like that.
Or even
Or the
just with the goals of the-
Recommendation.
Yeah.
Yeah, there's a reference.
Like,
The committees.
Yeah.
But so I have a question. It's not clear to me that we're actually spending Vermonters' money on this. I've understood that this is all to be paid for by insurance companies.
Well, I think to the extent that we also want to have insurance companies spend as
Little as
Yeah.
possible.
necessary.
Healthcare costs, yeah.
Yeah, all right, just want to be clear about that.
So there is no
because I had somebody ask me yesterday, I'm glad you brought it up. So there is no taxpayer dollars. I said, no, I said,
Insurance companies will be paying for it.
that's what I told them.
The way I understand it, Jessica can correct me if I'm wrong, because I asked this question yesterday, because some of the wording here was
That's what I
confusing to
thought.
me. The department, the state obtains the lowest possible cost. The vaccine is obtained from the physician's office and then is billed to the insurance companies. And
That's what I,
the department has a per
use.
per member per month kind of thing that then funds the program. So yes, I think it's I think the wording is okay. in
And
terms
the
of
advantage
purchase.
of having set up this whole program is that it's possible to get a much lower price if you're buying in bulk rather than different
right,
places buying it separately.
like no taxpayer dollar.
I think,
Okay.
yeah,
I told them that, it's just,
we did
Okay.
agree to some kind of language to say that we want the lowest price.
Consistent with
Consistent with our.
the goals of the-
The goals of
the
the
state, goals of the program. goals of the
Vermont's
state.
immunization program or
Yeah.
something like that. The states.
Madam Chair.
Yeah,
Jessica Shabana, Department of Health. And on this purchasing thing, just one clarification for the committee. So the department would only purchase the vaccines outside of the CDC contract if they're no longer available or if there were strings attached. And the lowest cost piece would be if we needed to maintain access to the vaccines by purchasing outside of the CDC. Because I think our experience is that CDC will always provide the lowest cost if they do opt for the vaccines without strings, so we would default to that as the purchasing.
so you're saying,
source.
that qualifier, lowest available cost, is only applying to the other
I
vendor?
think it could apply to everything because CDC is always, like in our experience, it would always be the lowest cost.
Yeah.
If they do offer it without strings, but it would be more.
So I think
other vendors.
okay, so I think that with the suggestion, just to summarize, we want to keep lowest available cost. We want to keep another vendor. People are wanting to keep CDC, but we want to stay consistent with the goals of Vermont's immunization program or recommendations. Is that what I
Yes.
summarize what people said? Okay. Okay. This has sort of turned into a little bit of markup. Sorry, Katie. Okay, again, do you have immunization?
I do.
Clarification?
Oh. To hear that.
Yeah.
And it is a bit of a technical, so, immunization allows us to encompass both vaccines and some of these other new products, like the RSV monoclonal antibody that's approved for use. That's not technically a vaccine, so immunization is like a little bit of a better term that would allow us access to these newer types of protections.
Okay, that's not something I was anticipating.
No, me neither.
It just means you could buy it and make it available, in other words.
Right, exactly. So it's really talking about the product.
But in terms of where it's used elsewhere without scanning through, would that open it that the advisory committee could say, well, we think this one should be on a recommended list?
There's still the definition of immunization in there that has specifics about what the product would be, but it is, there may be other sorts of new technologies that provide that sort of protection that wouldn't typically be considered vaccine.
What I hear you saying is that the science is evolving, as science does, and you're trying to have this language be flexible enough to accommodate all of that. Okay, does that satisfy people?
Yeah.
It does, yeah, it does for now. When we get to other sections of the bill, it may, my
Okay,
mind might recycle back.
okay. Okay, so I'm at the top of page 3 now, where this is where I got confused. On line 6. health insurance shall remit to the department the cost of, bless you, recommended immunizations as that cost is established by the commissioner. So are we saying that the health insurance I'm still confused by this. I don't know. Am I the only one who's confused by it? Because I'm trying to figure out.
I get what it's saying, but it is,
Self-referential.
Are we saying that health insurers can only bill the department for the cost that the department has established? Is that what that's saying, Jessica?
Yeah.
Where is this is the
I think
existing
yes.
language, right?
Well, no, the
No,
term
some of
that
it's
cost is,
Yeah.
yeah.
page 3, 6 through 8.
Yeah, and I think our suggestion there to add that cost is established was just to be clear about the reference back to what is being established by the commissioner. But, you know, if there's concern
Yeah.
or confusion.
It doesn't make it clearer.
But, yeah, if it's not making it clear, then I don't think it's an essential change.
Okay. So let's delete that cost is.
Okay.
The other thing for folks to know is that with the help of Jen and Katie this morning, they did identify the part of the Office of Professional Regulation miscellaneous bill that had a reference to the pharmacist that the department referenced yesterday. And because these they'll have two different implementation dates. We're gonna pull that language from there and put it into here. And we will, are working on getting PR to testify, just saying that that's okay, essentially. Because it is likely that these will have two different effective dates, and that will leave pharmacy in a odd space.
Yeah.
In between. Okay. So, moving on to page 4. Anybody have anything on the rest of page 3? It seemed like it was. Okay. On page 4 is the makeup of, which one is this? one
There's
now?
no changes at all to
No.
anything on page 4, other than the vaccine. and-
No, that's the funding advisory
Yeah.
committee. Okay, I'm looking for the,
That's later.
removal of the
That's
date.
later.
Yeah, okay.
The issue of designee was raised yesterday. And
Oh, I did, yeah. Yeah, that was on A and B, where it requires the executive officer of the Board of Pharmacy, and it requires the executive director of the Green Care Board. And anywhere else where we have a person, it says or designee. And usually I think that is sometimes drafting implies or designee, but if we're saying or designee in the same statute, I think we're confusing things.
I think
So we gotta go one or the other.
Well, can't you do a mixed? I mean, yeah, sometimes you want that.
Well, you might, if
specific
you want it, well, that's the question.
Yeah, that's my
Right, right, that is the question, yeah.
There,
Is there an intent for it to be that person and only that person? We've had statutes we passed that said that person and only that person,
Mhm.
and then the departments have gone and had a substitute person, it's like,
Yeah.
no.
But you also might find that the executive director of the Board of Pharmacies has someone who is like an expert in this
Yeah,
field.
yeah,
that they're-
exactly.
So is there any
Whatever.
objection to it for A and B inserting or designee? Okay,
Expectation is that
Jessica, do you think the department's okay with that? Okay. I think it's a good point that there are probably people, the executive director of the Green Mountain Care Board is probably not the most well-versed person.
Right,
Might not be.
right.
On this, so, okay. And then, this is something that I hadn't personally seen in a lot of other things, but it probably exists. it's very specific about saying that the Commissioner of Health appoints these people. So does that mean that recommendations go to the Commissioner of Health from these organizations and then they're appointed? So that theoretically means the Commissioner of Health could say, no, I want somebody different. I'm just wondering why it has to be appointed by the Commissioner of Health.
C through G,
Yeah,
yeah.
I know it's current language, but, well, once you start amending a bill.
Right, yeah, well, it's, I mean, I think that there's some distinction in that some of the groups they're not a group who can appoint their own member. And
Choose a
then
person.
somebody else has to appoint them, but some of them, they are their own group.
Right, like 3 representatives of health insurers,
Yeah,
doesn't-
one from each. Those health insurance would normally choose who the representative.
what's the 3rd largest health insurer? in
I was
Vermont?
like, yeah,
That's a Cigna
No,
okay.
by a lot less than.
Yeah, I would
They've
say.
always been, they're the 3, yeah.
Maybe.
But like G, it's like, G, there is no group, that would have to be somebody.
I'm just raising it because it
Yeah.
just seemed a little unusual.
Yeah, like for E and F, if I were to draft this now, I'd say a representative appointed by the Vermont chapter of the American Academy of Pediatrics.
Yeah.
Yeah,
And well, each of the health insurance would, because it says one from each, they would
Yeah,
each
so-
appoint their own.
right.
Yeah, so
D,
I-
E, and F ought to be.
I'm in favor of just having the groups appoint their own member rather than.
Yeah,
Other than G.
well, they probably have an association, I don't know,
No, maybe.
but we'll leave it
Yeah.
like that one, yeah.
They can speak
So in
up.
places where it's not necessary to have exactly what you were just speaking of, Katie.
So for D, you want the 3 insurers to do it.
Yeah.
Yeah.
And same with E and the same with F.
And C, this is interesting, nominated and then appointed. So you just
Yeah.
want it appointed by the director.
Yeah, the director of the blueprint, yeah. Okay, selecting a member from among mixed members at the first meeting of each calendar year, and then you don't have to meet. Sorry, I did find that
No, we
funny.
fixed that.
Yeah, we're
That's
fixing
so
that.
cool.
Um, Okay, I don't think there's anything else on that page unless anybody else has anything.
Can I flag something?
Yeah, of course.
Okay, this is to existing law, but there's a change in the other committee. So the change in this on lines 14 and 15, page 4, says the committee will receive administrative support from the Department of Health. The other committee currently has administrative, technical, and legal support from the Department of Health and legal and what is it? And technical support. There could be lots of reasons for that, but especially the legal support. I have heard over the past year or two that when that language about legal support is left out, that there's a gap in who answers questions, like open meeting law, like who would answer that question? So I'm just flagging it because I don't know, in the absence of saying that one entity is going to provide legal support, who is answering those types of questions.
Mhm. Well, it is, I don't know, Jessica, if you can provide any insight into why the department's suggesting removing that in the other committee?
I think we have run into some challenges with regards to how much legal support and what legal support is offered by the department to these committees. And so I think from our perspective, it was trying to eliminate that potential burden and confusion. But if there are potential gaps that are raised, I can certainly take that back and have more discussion with the department.
I sort of understand the sort of inherent, maybe potential conflict of interest, because it's supposed to be a group that's providing advice to the, recommendations to the department, and the department's then now providing legal assistance to. So I get that.
I can also understand like how it could be really demanding because the requests might be over and above what the department might have to, just a capacity issue.
Yeah, I'm not sure there'd be a capacity issue on this particular topic, but I think, I guess I'm just gonna ask Jessica if you can bring that back.
Yeah.
And, we would be making both of them consistent, so they would, I think we could probably remove technical, or maybe we leave technical in, and then the department could decide who provides technical assistance, like, that could be a technical question, I guess, on open meeting law. But we just have questions about why it's removed, and they both should be consistent, and I see that they were actually moving in the opposite direction of probably where we would move in terms of making, the department was making it consistent with what exists for this panel. But we would probably seek to add the other to this panel. It's probably the direction we would go. Okay, so we'll leave that one open, Katie.
Okay.
Thanks.
I
Yeah, go
I have a
ahead.
question on line 16. There was a request yesterday that rather than wait, that this might take effect on July 1st, that it might take effect immediately. We'll consider that at some other point. But if January, if it were to take effect soon, then it's really essentially a whole year before this line 16 report comes into, and I don't know if it's useful, if the information is just information needed to keep track of things, or if it's actually information that's going to be required to actually move ahead. Should we change that date in the first year?
I don't think we need to. This says by.
All right,
It
okay,
can be done before then.
okay. So
No-
it'll
no
just be
later.
a request from the commissioner to have the report.
To ask
sooner.
for it,
Yeah,
yeah.
that's it, okay. Okay,
We're at the top of page 5. We're leaving open the committee shall receive, what type of support from the Department of Health?
Okay.
So we're asking for more clarification.
Yeah.
Okay. And so at the top of page 5, we have, again, this is, looking at the state recommendation, so, removes the word federal purchase requirements. Okay, so this is also getting at the issue that people were raising before. If the federal recommendations don't further the goal of ensuring universal access, it's another paragraph referencing that,
Which does that, yeah.
that we're going to follow our state's recommendations.
Right.
Okay. All right, where is it weirdly placed that it only meets and then did we go by?
We
it?
haven't got,
We
yeah,
haven't got to it?
we've got to
All
it.
right. I keep thinking we're getting, like, I'm not sure why it wasn't there. Okay, okay.
Still at 6 pages.
Okay, so, all right, so this is a new section. I'm going to stop us now because,
Oh, yeah.
Thank you.
Can I just
We need to-
get some to think about? it?
Okay,
'Cause it's
sure.
a big, so
Quickly.
this is where I question that, now that we know the medical whether this should be recommended immunizations versus vaccines. Because that then potentially opens up to, recommendations on all sorts of other things. Maybe I'm just not sure. That's where I'm not
That's
clear
where you have
with
the
the
question.
broader, because it's a broader definition.
Okay,
So I need to understand better that change.
okay. I'm thinking, Lori and Jessica, that we should have Dr. Hildebrandt, maybe just zoom in, for a couple of, extra questions. But we'll wait until we get all the way through, so he doesn't have to do it more than once. Okay. All right. Thanks, Lori. We're all set.